personal experience. Our brains interpret certain signals that our body's giving it, and our brain is telling us what that should feel like. So pain is very relative to each person. 10 people having the exact same experience, physical, are gonna have 10 very different experiences, mentally and emotional.
What I see is the vast majority, at least 85–90% of the people that we treat here with stem cell therapy get better. They're gonna help. I just don't always know how they're gonna help or how much they're gonna help, but they're definitely gonna help you. Sometimes we need a little bit more, or sometimes we need to do some PRP, but they're gonna help you and you're gonna get better. And that's what I've seen, is that the vast majority, at least 90%, are better.
There's a lot of misunderstanding, and even the word exosome is like the word fruit. I mean, there are apples and oranges.
Right.
I'm dealing with one type of exosome right now because I'm trying to get as much knowledge about that one as I can.
After the third stem cell shot, I had stage 3 instead of stage 4. So that made me feel just absolutely wonderful. And I was just there Monday of this week, and my lungs are perfect, she says.
Wow.
That made me feel like $10 million, I gotta tell you that.
Welcome to episode 8 of Pain Revealed. Wow, can you believe it? Episode 8 of 9. So we're getting toward the end of the series. And boy, was there a lot of content. I think that we broke a record on this series as far as the amount of different interviews we did for a single series. And why? Because there's so much to explore in this very important topic. Pain is no joke. Chronic pain, acute pain, this is no laughing matter. There's a lot of solutions, a lot of innovators out there, and it's been our privilege to bring this to you, but we're not done. And if you're someone who's already invested in it, thank you so much for supporting the work that we're doing. And if you have not yet invested, now's the time. During the viewing period, and this is episode 8 of 9, but during this viewing period, that's when we have the steep discount on this. Really important, I believe, that you own this information. And if you see the value in it, then go ahead, buy it, own it, have it, and revisit it over and over again. So here we are, we're going into episode 8, some really terrific content here, some new things that maybe you haven't thought of or seen before. So let's dive right into it. My excitement for hyperbaric oxygen and what it represents for many people who are seeking solutions is growing. And in large part, that's because of my interview I had with Dr. Jason Saunders. Jason is an incredible expert that really understands hyperbaric oxygen in a unique way. And I think this is a solution that's out there for a lot of people that's hiding in plain sight. So check out this interview, you're gonna learn something. So Jason, great to be with you, and looking forward to having this conversation.
Thanks again for inviting me out.
Sure. So you have a specialty that you are now out speaking about to other doctors on hyperbaric oxygen therapy. What got you into that?
So we've been using hyperbaric oxygen for about 11 years in our office. It was actually a personal experience that began that process. I had herniated a disc working on my house.
Is that painful?
Yeah. And I'm a chiropractor, by the way. So
and I know from personal experience it's painful.
It's not great for business.
My own herniated disc. So here you are, ironically, as a chiropractor, you herniated a disc, and what happens?
So my wife's also a chiropractor, so I was getting treated pretty regularly. It took a few weeks. I got most of that under control, but I was left with drop foot and pain into my right ankle and right foot. And so that went on for about 8 months.
Now, you're talking about drop foot. Probably neurologists were trying to tell you, hey, that's a sign of compression and you can't stay that way very long, otherwise you might start losing neural function, more permanently, right?
Yeah, I mean, that's, I guess, conventional thought on that whole process,
Right.
As a chiropractor, I know I believe that we can heal. You know, I
Right.
just got to figure out why that's happening and, you know, where the pressure is and how to get that off. So, you know, I was getting treated. I was doing some, you know, rehabilitative exercises. I was, you know, doing my nutrition, and, you know, but it lingered for months.
Right.
I happened to actually be at a conference. It was a chiropractic conference. And they had a huge expo with lots of different vendors, and there was a guy with a chamber and hyperbaric oxygen,
Yeah.
portable hyperbaric oxygen chamber.
Right.
It just looked interesting to me. So I was like, hey, could I climb in? He was doing sample, you know, treatments.
Yep.
So I climbed in, he put me in, gave me a book to read while I was in there, and it seemed pretty interesting. I didn't think much of it. I was there for about maybe 45 minutes. I got out and started walking around the rest of the expo, and I started noticing I was getting like pins and needles, like different type of feeling in my foot than I've had in, you know, 6 or 7 months.
Wow.
And so I went back to him and I said, you know, is there something here? Like, did that few minutes in that chamber, did that affect my nerves? And so he started telling me like all the science behind how that's possible. Anyway, he agreed to let me go in. So I went in about 5 or 6 hours over the course of that weekend, and I got about 50% recovery in that drop foot in those 5 days.
And sort of controlled me. You didn't do anything else therapeutically. It was just that was what you
That
were
was
doing.
the only thing. Yeah, I wasn't getting treated otherwise, and I mean it was months anyway that I was. So so I did about 5 or 6 hours that weekend, and got really great changes. I literally bought one at the end of that seminar, brought it home, well, had it shipped, set it up. I treated myself for about 6 weeks,
Wow.
and had 100% recovery
Just from that.
just from that.
So it's interesting because you were doing all these other things, like you said, protocols as far as chiropractic, as far as the nutritional protocol, et cetera, and just adding that one last piece. So what did either the vendor tell you, or what have you discovered as far as saying, how is my peripheral nervous system, how are these nerves being affected by hyperbaric oxygen? Why did you suddenly start getting function back with what people would say, well, no, it's a herniated disc, it's mechanical compression,
Right.
you know, it's all these variables, you know, have nothing to do with oxygen, seemingly,
Right.
conventionally thinking. So what happened?
So, I mean, the way that it works in this particular case, and the same way it would work for a disc herniation, let's say, or any neuropathy, it's typically damage to the microcirculation, so like the really small blood vessels that are feeding our nervous system as they transverse through our body. So when there's the way oxygen exchange happens in our body is that red blood cells carry oxygen, and when they get to a capillary, which is like the smallest vessel, they release oxygen to our tissue, they collect carbon dioxide, and then they continue traveling back to the heart, back to the lungs, get oxygenated, and continue that process. The issue is that when there's damage to the microcirculation, red blood cells can't get through anymore. And if a red blood cell can't get through, oxygen can't get to that tissue. Now, the difference between that and hyperbaric oxygen is that through the increase in pressure, you're basically dissolving increased amounts of oxygen directly into the plasma of the blood. And so you're bypassing the red blood cell carrying capacity altogether. So right now, if you had a pulse oximeter, sitting here, we would be 98 to 100% oxygenated.
Right.
In a chamber, if you were 98, you'd get to 100 pretty quickly. But now you're actually supersaturating the tissue, and you're dissolving that into the liquid. Whereas the red blood cell can't get through that damaged capillary, the liquid can. And if the liquid can, now you're able to deliver oxygen to that tissue that was starving. And so in my case, that's exactly what was happening.
Very interesting. So with, I guess the view, if we're talking about pain, because a lot of people say, well, you had pain, you had all this, you had some dysfunction, and somehow you did this hyperbaric oxygen therapy and it resolved. But what's going on here relative to pain is you're not masking the pain with the therapy, which is what a lot of therapies do, saying, let's just see if we can get the body to ignore the pain.
Right.
You're actually creating healing that resolves the pain, which is a very different way of approaching pain therapy.
Right. I mean, rather than saying, well, let's try not to get that signal to our brain to interpret it, if it's neuropathic pain, right, pain especially from the nervous system, hyperbaric oxygen works best for areas that don't get great blood supply, so joints, the nervous system, things where there's damage like that. And so by literally fueling and feeding the tissue that's starving, it has the capacity to create a new healing response.
And as it should be, the pain is signaling, hey, there's a problem here, and when you're solving the problem, the pain
Would go away, right? It's not right. Pain isn't there for no reason. Right. The pain is trying to tell you something. I think the difference is that traditionally we say, well, I have this pain. How do I get rid of it? As opposed to, hey, I have this pain. What caused that? And can I fix that? And if I could heal, wouldn't that signal then naturally go away?
So what's interesting here also then is in some of the stem cell discussions that we've had, there's this concept of the integrity of the nervous system having an impact on stem cell utilization. With all the caveats that you're describing, a lot of times stem cells are being used in joints, where you have injury or degeneration. The tissue is white, meaning there's not really much blood in it, right. Which now says, okay, so how did the stem cell uptake or utilization or any of the cell therapies, how is it going to be facilitated so that we can get a better result? And you've been working with people who go through stem cell therapy and utilizing hyperbaric oxygen. So what was in your mind about doing that, and what kind of results are you seeing?
So we're involved in that in a few ways. One is there are natural ways that our body releases stem cells, and so we try to do things within our office to promote that. But on the other side, we have patients who come to us or stem cell doctors who refer to us because they understand the value of, hey, here's this new cell. We need this new cell to differentiate and start to look and act like whatever the tissue is that wherever we're putting it. So in a knee for cartilage or for bone or in a tendon but they understand that those tissues typically don't have great blood supply. And so if they don't get good blood supply, that means they're not getting nourishment, they can't get the nutrients to that tissue, and they're gonna struggle getting the inflammatory chemicals away from that tissue. And so they referred to us specifically because hyperbaric oxygen does both of those. One, it's providing that fuel source, regardless of what the blood supply might be, and it also helps the body carry away those inflammatory chemicals. So we're involved on both fronts.
And are you seeing, so theoretically, as far as as you abstractly describe it, makes a lot of sense. Are you seeing the actual results manifest in people that you're working on? Yeah,
it's hard to say from a standpoint that, I don't have the controlled environment. Somebody who's being referred to us, and I say, well, listen, you're in the not getting hyperbaric treated group, and you're in the hyperbaric treated group, right? So in our office, primarily, if they're coming to us, let's say from one of those doctors, we're seeing stem cells or exosomes being used, and they're being referred to us for oxygen, and then we're seeing the results, which typically are amazing. The only comparison I could draw, I guess, is to say that I do have patients who come into us for various reasons. It might be hyperbaric or might be nutritional or whatever we're doing. But they say something like, hey, well, I've had stem cells before and that didn't work. And typically when that's happened, there are a variety of stem cell options. And sometimes they do with hyperbaric, sometimes without hyperbaric, sometimes with nutritional protocols, sometimes without. And so, not all therapies are going to be created equally that way. And so as a result, we'll have patients who do come in who say, I've done stem cell and that didn't really work well for me. And part of that might be just that, they had the injections, but it didn't have the fuel, or the environment within that joint or wherever they're putting that wasn't healthy enough to let those stem cells really take.
And it's really kind of interesting in the sense that it is sort of, there's a few very critical variables that determine outcomes, right? It's not just saying anybody who gets cells injected, you're gonna this is gonna happen routinely through everybody, because it's not. There's more than just saying you got the cells in there. There's got to be an environment to facilitate the utilization of those cells and other such factors. So with hyperbaric oxygen, which is a focus of yours as far as one of the things you do in your own practice, oxygen is is one of those variables as far as the oxygenation of tissue. Right. I guess I would say, right? Now you have this interesting context because you're looking at it as a nutrient, or maybe the most critical nutrient of all, because people think in terms of taking supplements. So you're almost seeing this as it's like another supplementation, saying you get a certain amount of oxygen, from the environment, but now we're going to drive more. So what's your context for this?
So Exactly. I mean, I do. I look at oxygen as a nutrient, as a vitamin, if you will, right? It's something that we all need.
Right.
We need 100% saturation, right? If you've ever had a pulse oximeter on your finger, as we sit here talking, we're almost fully saturated, 98 to 100% saturated all the time. And we need that amount of oxygen just to sit here and have this conversation.
Right.
But there are times that you might either locally because of an injury or globally because of some respiratory issue or some type of infection where more oxygen than 100% is necessary to heal. And so just like with a certain vitamin, if you had a deficiency, there'd be consequences.
Right.
If you try to maintain a optimal range of that nutrient to make sure you have enough to do all the normal functions, and then periodically you may choose to mega dose that nutrient to try to help heal something because of whatever issue you might be having. And so, hyperbaric, if you don't get enough, it's hypoxic and tissue will die.
Yeah.
Likewise, there's an optimum range. It's 100% oxygenated all the time just for normal function. But then if there were a way where we could mega dose that oxygen periodically, we can promote some type of healing response. And, basically the only way to do that is through pressure.
So you said this earlier about the fact that when there's injury of tissue, that's what can prevent it from properly oxygenating. Because you'd say, why would you not be able to oxygenate? But because there's some kind of an injury, it's preventing it. And is it sort of like a vicious cycle? There's less oxygen, so there's less healing, less, it's kind of like is in this, this cycle.
So typically there's a cascade of events. So there might be a small tissue damage. That small tissue damage leads to a decrease in blood flow. That decrease in blood flow makes it such that we can't get nutrients to that tissue and we can't get rid of waste. As long as the cells are still alive in that area, they're still producing their own waste products.
Right.
And so as they just sit there without that proper blood flow, they start to just bathe in their own inflammation,
right,
which leads to further tissue damage, which leads to further blood flow issues. And that cycle just continues.
So what's interesting is it seems that it's remarkably simple, as a solution, the hyperbaric oxygen. I mean, it seems fundamental about getting oxygen to cells, and this seems like a fairly simple way to do it. No adverse effects?
So, it's what's remarkable to me, and maybe it's because of its simplicity is why it's been overlooked for so long, for so many conditions. If you look at the typical insurance reimbursement conditions for hyperbaric oxygen, it's things like gangrene, osteomyelitis, carbon monoxide poisoning, diabetic neuropathy. In these cases, these are really serious conditions.
Right.
Life-threatening in most cases, and at that time we're using oxygen to help them. Why are we waiting until someone's that far gone before we implement something that's so fundamental, we all need oxygen, something so safe, it's just pressurized oxygen and pressurized air, but it's so effective for healing tissue, for healing wounds, for killing infections. Right, so we end up using it in our office more on these investigational uses. So same concept. In other words, if it's good for diabetic neuropathy, it's good for neuropathy.
Right.
So disc herniations or trauma to a nerve or a muscle, right? If it's good for wound healing, for massive bed sores that aren't healing properly, it's good for all wound healing.
Right.
And really aging is wounds.
Yeah.
It's micro injuries that don't heal exactly the way we need them to, and they become cumulative over time, the way we were discussing about it before.
Right.
If you could actually periodically address those as they're happening, you could regenerate tissue literally real time. And if you could do that, that healing response is it's amazing. So the regeneration capacity is huge.
And your own case witnesses it personally, right, as we described earlier. But now on the clinical side, because you have this sort of academic and research side of hyperbaric oxygen, as you said, as far as indications, a lot of what you're talking about might be considered quote unquote investigational, but it's really not a leap of faith or logic to say, diabetic neuropathy is neuropathy. Bed sores are wounds, they're wounds. There's a lot of logic to what you're saying. It would make perfect sense. But is it corroborated by your clinical experience? Saying when you're working with individual people, this abstractly makes sense, but when you're putting it on the ground, are you seeing these results that you'd expect to see based on that?
Yeah, absolutely.
Yeah.
So, just like in let's say in a hospital setting where they're treating, the conditions I was talking about earlier, I think we're working backwards now. And so we're saying, well, if it works when things are really that bad, let's take it a step closer to before it gets to that place. Does it still work to help people heal? And then let's take another step and say, hey, before I get any of these issues, is this something I should be using for just general maintenance and well-being so that I don't actually even end up getting to that place? And so clinically, we use it in large amounts for TBI and concussion, so traumatic brain injury and concussion. We use it for dementia and Alzheimer's. We use it for MS and ALS. We use it for our varying arthritis, whether it's osteoarthritis or rheumatoid arthritis. We use it for a variety of different autoimmune conditions, autism, ADD, ADHD. I mean, anywhere where we're needing to fuel that body literally with the nutrients that we need to heal and improve function. In Israel, where they're able to do a little bit more outside the box treatment, they have a 2,000 person waiting list in their main clinic in Tel Aviv for just wellness-based uses.
Wow.
So, I mean, they're really ahead of it in terms of, hey, how do I use this tool so that I don't get dementia? How do I use this tool so I heal so I don't get autoimmunity, right?
Well, that's interesting. So in your case, if we're talking about pain, you had noticed after your first session in a hyperbaric chamber that you started getting tingling. You were finding some immediate results. What should people expect? So let's say somebody comes in, they've got significant pain. That's a byproduct of any number of the conditions you just said, whether it might be an osteoarthritis, maybe it's some kind of mechanical compression and neuropathy, or other such things that can cause extreme pain in an individual. Will people notice that, geez, after one session I'm noticing a change, or have you also witnessed where it's several sessions before they start to see the difference? What's typical?
Yeah, I would say the most common is a handful of sessions. In my particular case, I had done so much.
Yeah.
I had done months of treatment.
Yeah.
I was getting treated by my wife, another chiropractor. I was doing everything I knew nutritionally to reduce my inflammatory levels, right? So I'm keeping my food really clean. I'm taking supplements that help, nourish me and pull inflammation out. The last step, in my case, was adding the extra oxygen.
Right.
I would say in most people's cases, we're inflamed for a variety of reasons, right? Just to clarify, pain is a personal experience. Our brains interpret certain signals that our body's giving it, and our brain is telling us what that should feel like, right? So pain is very relative to each person. 10 people having the exact same experience, physical, are going to have 10 very different experiences mentally and emotionally in terms of what that feels like to them. And so when we're dealing with pain syndromes, we have to understand that it's controlling the initial signals that are sending that to our brain, and those signals are chemicals in our body. So sometimes that's coming in from our food, it's coming in from our drugs, or from our water, or from whatever else it's coming into our body somehow. It's coming from our immune system, so our immune system makes these chemicals of inflammation.
Right.
And so often the case, we could just do hyperbaric alone,
Right.
or stem cell alone. But the way I look at this is, if the environment is the same, and we put great, brand new, naive cells that are going to start to heal us, but if that environment is still overly inflamed, those cells can't do their magic, right? And so what we need to do, in my opinion, is change the body's environment. Look for the sources, extra sources of inflammation that don't need to be there. Do some preparatory work where we're actually really starting to lower the body's inflammatory responses. Clean things up, improve our detox pathways, right? So if we can clean up our detox pathways, we can start to allow our body to just flush a lot of these chemicals out naturally. Once things are starting to clean up, you may not feel a ton better, but you probably start to feel a little bit better. Most people do. Then inject some new cells. Then feed them with oxygen. And if you go through a process like that where you're cleaning up the environment, you're putting in the right nutrients, you're adding the new cells, you're adding the fuel, the oxygen to do it, those are the people who have the best results. But it does take, it's a process, right? Most of these people who, especially in chronic pain, I mean, this is months and years in the making. the whole body is now sensitized or hypersensitive to all of these chemicals in that whole environment. Pain is this signal in our brain. As certain pathways, nerves, start getting used often, they get easier to use. And so once this signal has irritated us, and we've sent that a couple 100,000 times to our brain, this hurts, this hurts, this hurts, the easier it is. So maybe it used to take this much of a signal for our brain to say that hurts. Now it takes this much of a signal for our brain to say, ooh, that hurts. And so it becomes this hypersensitive scenario.
It's like the body gains more awareness of an ongoing problem, and now it's saying we're gonna be more sensitive, in essence, to that problem. So so that it takes less stimulation to create the pain experience of pain.
Exactly.
Yeah, and that's a kind of a difficult thing, because if you're dealing with chronic pain, now suddenly, even if you can get back to old thresholds, you have to get even lower because it takes less stimulation to create the pain response in the body.
Correct.
Is there an impact on hyperbaric oxygen on the sensitization side of that equation?
Well, I think in a few different ways. One, as a result of being in the increased pressure environment, it actually helps push out a lot of our own chemicals that we're making that are these inflammatory cytokines, these chemicals that our immune system makes that help tell our brain how much things should hurt. So we're able to start pushing those out of our system. So that's one way that it helps. Another way that being in that environment changes that is that it creates new blood flow. So we're creating literally new blood vessels to areas. So we're getting that increased oxygen and increased capacity to get rid of other sources of inflammation. But it also creates an environment, it's called neuroplasticity. So, the brain learns all the time, right? And so just like what we're describing is really the brain is learning this pain pathway, it could also unlearn that pain pathway. And so what we need to do is we need to create changes and growth in nerve tissue so that it can relearn a new strategy for dealing with it, a new way. In other words, instead of saying, I always take this road from this pain to my brain, from this pain to my brain, I'm going to build a new road, right? Neuroplasticity. I'm going to build a new way to signal that brain so that I don't keep getting that signal over and over again. And so those are the long-term benefits of the hyperbaric oxygen.
So it's interesting because people with chronic pain, you're basically saying, an important dimension of this is a reset, right? Saying, hey, you've gone into a new pattern, and now we have to reset you so that pattern is, basically disappears, and you're back to your normal based state of function, as compared to saying, I've got a new pattern that's replicating over and over again. It's giving me pain.
Right.
So it's interesting because I've not considered the role before of hyperbaric oxygen in creating that reset, which is very interesting.
Yeah, I think that exactly. I say Control-Alt-Delete all the time. I use that all the time because that's what it is, but again, it's more than just, let's say, hyperbaric alone, right? In order to get Control-Alt-Delete, which literally means almost like restarting the brain evaluation of your environment. You need all those steps, Mike. You need to clean up that environment. You need to get the fuel proper. You need those new cells. Right, and so also part of the hyperbaric oxygen is, in addition to, I think what a lot of the newer research is coming out, that, again, long-term effects of hyperbaric is our own body's release of stem cells. So that's both from our bone marrow, but also from our central nervous system. So when we're talking about nervous system healing and resetting the brain's capacity, we're releasing enormous amounts of stem cells in our brain, in our nervous system, even just from being in that environment.
Wow. So what do you think the future of this is going to be? Where is it going?
So there are a lot of different chambers, okay? And different chambers are used for different purposes. So as it stands right now, you could go to a hospital where they're going to have pretty large machines, and those machines are capable of very high pressures and typically a lot of extra oxygen. So you have, either liquid oxygen in many cases, or at least a lot of big canisters of oxygen being, dumped in, and the entire pressurization of that chamber is done through 100% oxygen. those types of chambers are necessary for treating certain types of conditions. So the conditions we were talking about in terms of the insurance reimbursable conditions, so the gangrene, the osteomyelitis, you need really high pressure and you need a lot of extra oxygen in order to deal with those types of scenarios.
So these are the circumstances where, it's basically a somewhat radical intervention. Hey, you got an extreme problem, maybe something that's life-threatening even, and we have to put you in a chamber, and this is, I'm sure, much more expensive apparatus, and it's pretty extreme in its intervention.
Right. I mean, it's a much more expensive machine. There are a lot of different options now for hyperbaric oxygen and different delivery systems depending on the condition and the frequency needed. So for some of those insurance-based conditions we were talking about, you need a really large, very expensive, highly regulated hyperbaric oxygen chamber. They're typically filled with 100% oxygen. So you're basically taking 100% oxygen from either a liquid oxygen source or from tanks, and you're filling the entire chamber with 100% oxygen. You're basically making an oxygen tank.
These are usually like in hospitals?
So this is like in a hospital setting. And those are used for treating conditions that we were talking about before, like osteomyelitis and gangrene, right? And certain wound healings that won't heal, naturally. So that type of chamber is necessary for those types of issues. And I don't see that changing. That's the way that needs to be.
Right.
Likewise, there are sort of a mid-range type of hyperbaric oxygen treatment that a doctor could run in their clinic relatively easily. There's less restriction on it due to the fact that you're not filling the chamber with 100% oxygen. You could still pipe in oxygen separately through a mask or a hood, but you're not filling the entire chamber with 100% oxygen, and you're still capable of going to moderate range depths, 2 atmospheres, 3 atmospheres, when needed for certain types of conditions. Those would be more like Lyme disease or dementia or things like that. And then now there's this whole other range of hyperbaric medicine, which is considered mild hyperbaric. And in mild hyperbaric, they're using portable chambers. And so these chambers, instead of being large steel or acrylic chambers, these are soft vinyl chambers, basically. And people can have them in their office. So a doctor could have something like that in their office and treat patients like that. People could also have those in their home. And so to answer your question, what the future of hyperbaric medicine looks like, to me, it looks like either it becomes much more available in a clinical setting, where much more doctors are using it, even just for basic concussion and TBI, some certain inflammatory conditions related to autoimmunity. But I also see it being something that's very readily found in people's homes, where they're just self-treating, once a month, twice a month, once a week if they need to, whatever the case might be, just as an ongoing, I'm trying to maintain my health and my well-being.
So it's a wellness protocol.
Exactly.
So basically, it'd be almost proactive as compared to waiting for something to be wrong and utilizing it.
Correct. Again, something like I said, it's something that's so safe and it's so fundamental. Why wouldn't we do that?
And in these portable ones, is that what you're using in your office and what you use with your patients?
So we have both. Okay. So in our clinic, we have a hard chamber, a steel chamber that is capable of 3 atmospheres. And we do pipe in oxygen for certain people, for certain conditions. And then we also have a soft chamber in our office. We also have 5 or 6 soft chambers that we own that we will rent periodically to patients who, if they might need it for a month or 2 months or 6 months, depending on what type of issue they have.
Now, I know you said in hospitals, they're using pure oxygen. The source might be liquid oxygen, to pipe it in. On the the non-portable unit like you have in your office, is that the same thing, or are you using ambient air to pressurize, or how's that work?
Yeah, so unlike that hospital type setting, these mid-range type chambers, which are still steel chambers, they're still capable of pretty high pressure, so 2 or 3 atmospheres. Primarily, those are actually being filled with ambient air, and then you could add oxygen to that. So we might pipe in oxygen through a mask or through a hood, but the chamber itself is being filled strictly with air. And so because of that, the safety is much higher and the restrictions are actually much lower. There's really no risk. People could bring their phone or a computer or a book. There's really much less regulation about what you have to wear and what you can and cannot do inside that chamber. On the portable chambers, even more so. So those are basically, they're mild, so they're not able to go to that same pressure, so they stay around 1.3 atmospheres, and those are filled with air, and you cannot pipe 100% O2 into them. So they're filled with air, which still, if you understand the idea of hyperbaric oxygen, right now the air we're breathing is 21% oxygen, okay? So let's just say there were 100 units of air, 21 of them would be oxygen right now. Now, because we're pressurizing the chamber, we could fit a lot more air into that chamber than what we're breathing. Let's just say 3 times. Then instead of 21 molecules of oxygen in this room, there'd be 63 molecules of oxygen in the room.
I see.
So you're still getting an enormous benefit of increased exposure and increased absorption.
Right.
Also, with those soft chambers, you're able to pipe in what's called an oxygen concentrator. So those are not pure 100% O2. Those are about 96 to 98% oxygen. Again, you can pipe that through a mask and breathe that in.
So the mix can vary based on the type of chamber as far as how much oxygen to other types of air molecules would be present.
Correct.
Yeah.
And the thing to think about, the way we talk about it is the amount of oxygen, the amount of pressure, and the amount of minutes. So OPM.
Yeah.
So oxygen, in terms of, is it just ambient air, so 21% oxygen, but it's being pressurized, versus an oxygen concentrator, which has 96 or 98% oxygen, versus pure medical O2, which is 100% oxygen. So we can manipulate those 3 variables.
Right.
And then we can manipulate the pressure. So in a soft chamber, we're going to be doing 1.3 atmospheres. In a hard chamber, maybe 1.5, 1.75, 2.0 atmospheres. So you can change the amount of pressure, and then minutes. How long are you going to stay inside that chamber? So in a lot of cases, if all you had, let's just say, was a soft chamber instead of a hard chamber, so we're getting a little less pressure and we're getting a little less oxygen, you could also just do it more frequently or stay in a little bit longer and be able to get that same dosage. So we're able to manipulate those 3 variables to create the protocols for patients to understand how often, how frequent they need to use them.
Do you see that this is still an emerging science, or that this the application of hyperbaric oxygen is something that there's interest in, and the interest is growing, or do you see it's kind of like at an equilibrium? How do you see it?
I mean, it's growing tremendously. Yeah. I think it's been around a little over 300 years, and I would say right now, in this moment, we are in its infancy.
Wow.
And not only in its usage, but also in its understanding. We're just really first studying what those short and long-term benefits of being in a pressurized environment are, and the variety of different applications or conditions that it's being used for.
So in summary, then, people who have suffered with chronic pain and have had challenges and tried varying forms of therapies and interventions, and they seem to have made little to no progress, if they were to maybe add the hyperbaric oxygen to the protocol, it might be a thing that takes them over the line.
Absolutely. I think both the practitioners that are offering different pain management treatments, as well as patients on their own trying to learn more about what their options are, I think we need more awareness on both ends of that.
Right.
Because I think ultimately, yes, I think in many cases where a patient has tried this therapy or that therapy, the therapies are great. The intervention was absolutely correct, but for varying reasons, it didn't work as well as it could have. Potentially one of those reasons would be missing the fuel needed to create that healing response.
Which, again, we go back to your own personal experience, what got you started, and that was the case. I mean, doing, certain interventions, chiropractic, cleaning up your diet, getting supplementation. I mean, you really had the full package of a natural approach towards trying to solve your problem, and there was that one missing piece of a puzzle that put it over the edge.
Exactly.
Yeah, so really, really interesting. So thank you so much for sharing your experience and your wisdom around this, and I'm hoping that for people who are challenged and are looking for solutions, that this might be something they consider.
Yeah, absolutely. I mean, I'm happy to try to share that so that more people can start to learn more about what their options are and hopefully find their solution.
So Jason, also, if people want to find you, you're at the Core Therapies Center in New Jersey.
Correct, yeah. Core Therapies is our main clinic name. We run the hyperbaric oxygen out of New Jersey HBOT.
So, and that's what it's called. So if somebody wanted to learn more about you or find that out, that's how they could do that.
Absolutely.
Great. Thanks so very much.
You're very welcome.
When you see Dr. Jason Saunders, don't you just think to yourself, what a great human. He really is a good, caring doctor with a lot of knowledge. I learned a lot from him about this whole hyperbaric oxygen arena, and he's out there in the world making a difference in people's lives. Well, let's learn some more things about cell therapy and talk to Stephen Cox. This is a guy that utilizes this as a clinician every single day, and you're going to learn some things about this in this interview, so tune in. So, Steve, thanks for taking some time to sit down and talk to us today.
Yeah, happy to do it.
Yeah, and I got to watch you work a bit today, so it was kind of fun seeing you do your thing. Tell me about your background. How'd you get involved in what you're doing?
So after I graduated from physician assistant school at Eastern Virginia Medical School, I got right into orthopedic surgery. I did about a decade's worth of orthopedic surgery.
What kind of stuff would that include?
So that was mostly joint replacements, ACL reconstructions, sports medicine, but I also did foot and back and shoulder and knee. I mean, you name
Everything,
it, I did it, yeah.
And you were like, so you would be working with the orthopedic surgeons in all these procedures?
Correct, yeah. Usually as first assists right across the table from them, helping them with anything they need.
And then from there, what happened?
So I moved here to Utah from Washington State. I got in with a good surgeon in Cottonwood Heights. We did a lot of really good procedures, but I was starting to see more and more of my patients just being unhappy after their surgeries. You know, total knee replacement, get a blood clot or an infection, or have to have a repeat surgery, and I really took it hard. It was very frustrating, and it was really sad for me to see patients coming back saying to me, Steve, you know, I wish I'd never had the surgery. You know, and so we started getting into stem cells. Actually, me and that surgeon, we started doing stem cell procedures for mostly our young athletes who would have ACL reconstruction, PCL reconstruction, where we would do stem cell injections after the procedure to strengthen and help the ACL heal faster. And then we started thinking, well, what if we did this prior to surgery for people who had like partial tears, partial rotator cuff tears, partial ACL tears, you know, and keep them out of surgery. And so we continued to do that. I did that for about a year, and then decided I just wanted to get out of the surgery scene altogether and get into regenerative medicine full time. So I found East West Health and have been doing that for almost a year now.
And has it lived up to your expectations? In other words, you had a certain anticipation, I imagine, coming into a new environment, a non-surgical environment, and starting to do this regenerative work. So was it better, worse, what you expected?
Well, I'll admit, being trained in Western medicine, I was a little skeptical, you know, of acupuncture, of things like that. But, you know, stem cells in general, we're not taught on it. We're not trained on it. It's something that hasn't been tested a whole lot, but they're doing it right now. And so I was a little skeptical to come in with, but I'm a believer now. I mean, I've come in, I've done the procedures, I've done the follow-up, I've seen people get better. Most of the people get better, and occasionally we have people who don't respond, but even then we'll do PRP for them, we'll do acupuncture for them, and in some ways they get better.
So this is one thing you spoke to, saying, hey, you know, it's kind of new, you're not really trained in it. What kind of training is necessary to be, you know, a good clinician to be able to, you know, to do cell therapy in the way that you guys do it?
Well, Reagan has a really good program here that he set up. We do a lot of patient education, and as far as training newcomers like me, you know, luckily I'd already had stem cell procedure training before, as well as injection training and ultrasound training. And so now it's just a matter of learning the data and the research associated with the stem cells, which Reagan took us all through it, and you know, we continue to go through all the research and see, okay, what does this help? What doctors are doing the research? What studies have we seen on Parkinson's, on Alzheimer's, you know, on osteoarthritis, which is one of the most common things we treat here.
Yeah, and so the actual delivery of the stem cells, you know, the injection process, that's something I guess you've been doing for a long time as far as, you know, doing needle injections, you know, as an orthopedic PA. I mean, yeah, I imagine you've been doing a lot of that in the past.
Yeah, over a decade.
Yeah, and you know, because I noticed too, you know, you're using ultrasound to help guide the needle, find the locations, you're marking them. You know, there's a procedure and a process saying, yeah, this isn't this guy's first barbecue here. He's kind of done this a few times.
That's right. Yeah, and it's easy to not use the ultrasound when you've done as many injections as I have, but I think the ultrasound really provides a good point for the patient to see, okay, this guy knows what he's doing, he's using the ultrasound, we're having a second image inside the knee so we can see where the needle is going. Do I absolutely need to use the ultrasound? No, but I think it's a good idea.
Yeah. So the pushback I get as we've been pursuing this has been, well, people aren't really trained that much in stem cells, and they're not, their people are kind of like it's the wild, wild west, and people are just setting up shop and doing it, etc. So that's kind of the controversy, because in some respects, I'm looking at patients who are not well healed. I mean, this is a big investment for them,
right?
And they're going in and they're getting the procedure done, but they also have tears in their eyes telling me about how it's changed their life or maybe even saved their life to a large degree. And then on the other side, I've got sort of these skeptics saying it's not validated, it's not proven, and people aren't appropriately trained in it. So how do you see it in this whole world of stem cell therapy?
Well, I think there's definitely clinics like that where they set up shop. Maybe they're not trained as well as they should be. They're just injecting the stem cells, and we don't know exactly where they're getting them from, and then they send them out the door. That's why we focus here on a full whole body holistic program where we look at the body head to toe. We run labs. We combine Western and Eastern medicine. We make sure we get the results because we have a healing stack. We do stem cells, then we do PRP, then we do acupuncture, then we do PRP, and maybe a booster stem cell later on if they're still having some issues. Yes, it is an investment, but it's an investment in your health. It's an investment in your body, which you're in 100% of the time.
Now, you said earlier, one of the things that became almost discouraging for you, and it's interesting to me how much you care, because a lot of times people are maybe somewhat indifferent or feel like they have to be. But when you're doing the orthopedic work, and how many people would literally have regrets about having the surgery, and that almost moved you out of the field, in a sense, is the opposite happening? I mean, from your own personal experience, and now I'm sure you've done a lot of injections, a lot of cell therapy at this point, are you seeing like, wow, the vast majority of people are getting a pretty decent result?
That's exactly what I'm seeing. It's not 100%, and like I always tell people, there's no guarantee in medicine. Just because we can't know everything. We're trying to, and we're making vast improvements all the time, but what I see is the vast majority, at least 85-90% of the people that we treat here with stem cell therapy get better. It helps them in some way, and I always tell the patients, because they always ask, well, how do you know the stem cells are going to help? I said, they're going to help. I just don't always know how they're going to help or how much they're going to help, but they're definitely going to help you. And sometimes we need a little bit more, or sometimes we need to do some PRP, but they're going to help you and you're going to get better. And that's what I've seen, is that the vast majority, at least 90%, are better.
Now, is the descriptor stem cell therapy, is that adequate, or is that maybe a little bit of a misnomer? Because as I'm hearing you explain the components of what you're injecting into the patient, watching you do it with the patient, you're talking about a bunch of other cells that aren't stem cells, and that it almost seems like a minority of the cells in the solution are actual stem cells, and there's all these other things in there. So can you speak to that a little bit? Sure.
So we get our stem cells from Utah Cord Bank. They're from C-section deliveries, from the perinatal tissue, scheduled C-section deliveries in the surrounding local hospitals. And of course, not all of them. I mean, you can never say that all of the cells are stem cells. And so the vast majority of the cells that we get in 1 cc of product from Utah Cord Bank is proteins, cytokines, exosomes, a lot of healing factors, growth factors, some other cellular substrates, and then probably about 37 to 33 million cells out of the 40 million cells that are in this 1 cc. Right. About 3 to 5 million are probably the live mesenchymal stem cells that we get directly from the placental tissue, the Wharton-Shelley, and the cord blood.
So these other cells, though, play a role, or maybe even an important role, in the actual outcome or the healing as compared to just the stem cells?
Yeah, they play a huge role. They're actually the major components that are in PRP. And so PRP has been used for decades for multiple injuries, including rotator cuff tears, patellar tendon tears, things like that. And so we want all that good stuff. That's all the goodies, right? Because that's what helps us to heal. That's what helps our body to heal. The stem cells just add another level on top of that, because they actually can replicate and become new tissue, become the tissue that's been damaged or lost. And so not only do we have all of that good plasma, all those proteins and cytokines and healing factors, now we have the stem cells on top of that as well. And so it's all very, very important.
So if I'm someone who's considering this procedure, I've been suffering from pain, been told maybe I need surgery, I would like to not have surgery, and I'd want to try something else first to avoid it. And I'm researching, well, where do I want to go have this done? How important is the actual source materials that a center gets? Like, what should I be asking?
The source material is crucially important because you don't want to go somewhere, have them inject something into your body and have it be just nothing, right? Placebo. Right? We know placebo effect works, and there are some clinics that are doing that, which I have a big moral issue with. I want to know that if I'm going somewhere for stem cells, that I'm actually getting live stem cells, that they're actually going to do something.
Right.
And so you have to question, okay, where are you getting your stem cells from? What lab are you getting it from? Has that lab been tested by the FDA or by a third-party lab to say that, yeah, your cells actually are live?
Right.
If it's just we get them from, who hasn't, we don't know where we get them. I mean, how can you know that the cells are real? How can you know that they're alive?
Right.
And this was something that Reagan talked about, and he actually did a lot of testing on about 4 years ago.
So when you say you did a lot of testing, can you do your own testing to see if what's represented versus what you got is the same thing?
Well, sure. And his take on it was, well, I have all these companies coming to me saying, hey, use our stem cells, we're the best, right?
Kind of like the pharmaceutical companies trying to sell you their drugs, right? Yeah.
Exactly. And so how do you know who's telling the truth? How do you know which ones are the best? So he actually got a third-party lab in Seattle, Washington, to test a bunch of samples of different companies, different labs. To see who had the most live stem cells, if any, who could form a colony unit, and who was viable, who had the most cells. And what it came back at was actually quite a few of them had cells that were not live at all. Post-thaw, they were just dead cells.
Wow.
And not that that's a bad thing. I mean, they'll probably still help you because it still has all the healing factors and everything, but there's no live stem cells there. Right.
So it'd be a misrepresentation. You say, hey, you're paying thousands of dollars for stem cell therapy, but there's no live stem cells in what you're doing.
Right. And unfortunately, that's we saw in some of the samples that we got. And what we found was actually the best sample that this third-party lab, Da Vinci Labs, told us was Utah Cord Bank, right here in our backyard, which was not a cord bank we were using at the time. We were using one from Texas. Yeah. And so they said, they had the best, most live stem cells post-thaw, the best volume, and we're able to form an actual colony on their assay, which is great because that means they're actually becoming something.
Yeah. And when you talk about thawed, so this stuff comes in frozen. So I guess what happens is that when they harvest these materials, they freeze them pretty instantaneously. And then you guys see what happens once it's thawed, what survives.
Right, exactly. And there's a whole process. They have a time window from the time that the tissue is delivered to them. They get it to their lab within 10 minutes. Because stem cells don't do very well outside the body or outside a controlled environment. And so they get it to the lab, and now the more tissue you have and the more in depth you do the cleaning sterilization process, the less live stem cells you're going to have back. If you sterilize too much, no live stem cells, right? So you have to sterilize just enough and just take the top two layers of the placenta only to get those mesenchymal stem cells, and then immediately cryofreeze it so that we can preserve the viability of those cells.
So what is the biggest surprise you've experienced, since you've been, doing this for the last year here?
The biggest surprise is some of the worst knees that I've seen in my entire career. People barely being able to walk, lots of pain, are getting better. Not that they're like they were when they were 20 years old, but they're getting better and they can walk better and they can function better because at the end of the day, that's all that matters, really.
Would these have otherwise been surgical cases?
For sure. I mean, I had one gentleman come in who said, I have surgery scheduled for next week, both knees, and I don't want to do it. I'm scared to death. What can you do for me? I looked at his knees. Of course, he's bone on bone, both knees. He's walking, he's only 62, walking like a 90-year-old, hunched over on a walker. And I said, they're pretty far gone, but we'll do the injections. I think we can make you better and not have to have that surgery. We did those injections the next day. I saw him, then the day after that, he came back for acupuncture. He was walking without a walker. He was using a cane.
Just the next day?
Just the next day.
And normally it takes longer than that, or?
Normally it does, but again, these stem cells that have a natural anti-inflammatory effect. And so they immediately bring down the inflammation in the joint, so the joint feels better. And so he's doing great. I saw him a week later, not using a cane at all, standing up, sitting down, standing up, sitting down. Again, this is the anti-inflammatory effect. But the stem cells build on that, see? If we have that inflammation out of the joint, then the stem cells can build on that and just keep healing the joint. And 3 months, at the 3-month mark I saw him, he's doing great. He'd lost 20 pounds, thanks to the diet, right? But he's also exercising more because he can walk, he can move. He's like, I can get on my treadmill now and walk, whereas before I wouldn't even try. Wow. You know, and so 6 months, I just spoke to him on the phone, I think it was 2 weeks ago, doing great, still going. He's sticking with the diet, him and his wife. He's lost weight, he's moving better, he canceled his surgery. I mean, these are things that before he would have came in to see me at the clinic, I would have been like, wow, yeah, you need surgery. Let's sign you up for total knee replacement, which is what they did. And now he's surgery-free and exercising and living a better life.
I mean, total knee replacement's a pretty brutal surgery, right? I mean, that's...
I mean, it's invasive.
Yeah.
It's a fairly large incision, and you have to cut the bone and replace it with metal and plastic.
Yeah.
You know?
Yeah, so it's no little thing.
No. Yeah. It used to be a week in the hospital.
Wow.
Now they've got it down to be a same-day surgery, which is great. I mean, they're making strides and progress, but still, it's a big surgery, not without its risks.
Wow. So do you love your job now?
I love my job now.
Yeah, I mean, it's like gotta be exciting to show up and see these kinds of results. I mean, that's pretty dramatic.
I mean, it's wonderful. It's wonderful to see people get better and just be super, super happy that they didn't have to go to the surgery. I mean, it's a lot of anxiety off of them.
Right.
It's anxiety off of me, you know, because I can help them with a minimally invasive procedure that can actually reverse the damage, the aging process, the degeneration, and help the cartilage and meniscus heal back.
And then you know, with the collateral things, like you said, you know, if they're changing their diet, they're changing their lifestyle, they're getting acupuncture. Do these things all kind of synergize with each other?
They do, and I think if you're looking for a stem cell clinic, you have to look at one that looks at your whole body. You can't just be, I'm going to stick stem cells in you, they're the miracle magic bullet and send you out the door. That's not the case, really. They work wonders, but they have to have a good environment to work as well. And so that's why we have diet coaching. That's why we do labs and genetic testing. That's why we do functional medicine and coach on vitamins and minerals and herbs and natural holistic treatment remedies that can get the body healthy. Because we need a best environment for the stem cells to work the best.
Well, I got to tell you, Steve, your enthusiasm for what you do certainly bubbles through, and I appreciate you sharing your story because it really tells more about what this all means. Because of what you've seen and you know now what you're doing. So I thank you for sharing all of that and being here with us today.
Oh yeah, happy to. Thank you, Patrick.
So really interesting to see this point of view, right? This procedure is evolving over time, and when you talk to somebody who's been doing it clinically for a while, you start to get a sense of what the trend is. So I really appreciated Stephen's time and the knowledge that he shared. Get ready for a very entertaining interview. Duncan Ross is very smart, has great academic credentials, and he's also quite irreverent. And I believe he's pushing the envelope in this whole world of cell therapy and stem cells and exosomes, etc. So this is a guy that you're going to be entertained by, but you're also going to learn a lot from him. Well, Duncan, thanks for coming and sitting down. I know we're going to have a good time. We've been laughing very hard leading up to this interview, so we're trying to get through it now. You are a colorful character with a colorful past. So let's talk about how you got involved in the career you're in right now.
Well, my father was a scientist, and I grew up having things explained to me well. And I was going to be a physician. I got into medical school, but I went off to do other things. But when my father got leukemia, which was from a myelodysplasia, so it took years for him to get that leukemia. And I really feel bad for people that find out that they have 6 months to live when the leukemia is really disseminated. But we actually had 5 years to know what was happening. And as a scientist, he started trying to research, and I was trying to research with him. And sadly, it's impossible, right? When you get into those journals, which I am now published in, you see all kinds of different results. And so you try to go for the safest one, thinking that that's the appropriate approach, but it's actually not. And so it takes, this was in 2004, I started graduate school, so only now do I even have an idea of how you should probably approach that. So he passed away, but I got into graduate school before that happened. And I ended up in the biochemistry department, which is not what I wanted. I just wanted to get into grad school so I could have access to literature. But it's actually very fortunate. That's why we're here doing this exosome thing. It's because starting in the biochemistry department and not even understanding what you're doing. Like when you're in there, all you're working on is proteins and RNA and DNA. And you're talking about proteins, you don't even know what they do. And now your mentor did, because that's why he picked that project. But if you talk about S6 kinase, what do I care about? I don't even know, what do I care about S6 kinase for? So I spent a lot of time in that department, and I have publications in it. And then I found out that there was a very prominent mouse leukemia researcher in the University of Miami, which is only because a girl in his lab was married to a guy in my lab. That's how I knew that he existed.
Wow.
But nobody in the biochemistry department knows anybody in the immunology department. So he said, you want to be in that laboratory. So I switched. So I only have one PhD, but in effect I have two. I have all the coursework in biochemistry and all the coursework in immunology. And I really loved his lab, and I really loved the understanding of inflammation you get in graft versus host disease and bone marrow transplantation. I mean, it's really robust, and that's why I find it funny that, in regenerative medicine, everybody treats it with bone marrow, right? Well, we know a lot about bone marrow. We've known about it since 1950, and if you were a hematologist or came from a lab like I do, you know all that past research. And most importantly, you know the proteins and pathways involved in it. So when I saw sort of the misinformation that was being spilled out in regenerative medicine, I thought it would be a good place for me to go. And I was also interested in what could be affected. So there was a company called Osiris that had a trial using allogeneic mesenchymal stem cells to suppress graft versus host disease, chronic graft versus host disease, which is what I study, right?
Can you just explain what that means, differentiating?
So when I take my cells and put them into you, they'll be rejected right away. You might even notice it happens so fast. But if I suppress your immune system, I can get my cells into you. But they're going to start to attack you because they're different. So that's why we try to match kidneys and HLA 10 out of 10 match. Now, in reality, you can't match for everything because you have minor antigen mismatches that are impossible to suppress. So you're always going to get some type of inflammation. That's why you have to take immunosuppressant drugs. And that's called chronic graft versus host disease, when it takes a long time and it's just disseminated, and you start to get fibrosis, and eventually it's going to kill you. So suppressing that is very important to me, but how do you do it? So there's a number of different ways. The best way would be using a regulatory T cell, which is the anti-inflammatory cell of your body. However, those are difficult to culture. Mesenchymal stem cells are easier to culture, and they express a lot of the same proteins. So seeing that this company, Osiris, did that with 14 million cells, I became interested in using 7 million mesenchymal stem cells to try to suppress less difficult inflammations, like, say, arthritis or something like that. And so I started working with autologous cells from patients and culturing them and looking at what their effects were. And it started to become glaringly apparent that everybody's cells are different. And no matter what you think your age is actually different. And I can't tell you until I start to grow your cells out. But it's definitely younger cells are better than older cells. And I had an 18-year-old paraplegic patient whose cells were growing wonderfully, and I had a 70-year-old patient whose cells wouldn't grow. And I didn't know what to do. I tried everything. Eventually I thought, well, paracrine effect is a word that you read in a paper, but maybe it's true. So let me take just the protein and content of the young girl's cells, not the cells, and see what they do to these older patient cells. And I put them in there, and the older patient cells started growing. Now, I would never have done that if the older patient cells weren't growing, because you don't really want something from one person in with something from somebody else.
Right.
But I didn't have a choice anymore. I tried everything else. So those cells started to grow, and that immediately made me aware that I had been throwing out the good stuff over years. When I was culturing these cells in a very expensive animal-free medium that I use, these growth factors were in the supernatant. So this is in 2014. I started doing some research, and I found that in Asia and Singapore, there was a lot of literature on exosomes, which is how cells communicate. And I had never understood how having worked with proteins and knowing how labile they are and how hard they are to work with, I never understood how they could get through the circulation to tell some other cell to do something. But by the time they get out into the environment, like around here, there's RNases and proteases all over the place that break these things down. So what's really happening is that these proteins and messages are being secreted in a protective lipid vesicle. That's how they're getting to other cells. So if you take a cell membrane and you butt it out, you have now an exosome which can go over to another cell and integrate with that cell membrane and then deposit the contents into the cytoplasm. Once that content is in the cytoplasm, it can start being expressed. So other cells become a factory for what the original cell wanted to tell you to do. And the way I like to think about it is, if you like to think about the center of your body when you're a child, you think it's your heart, right? But the center of your body is running throughout every organ, and those are the mesenchymal stem cell. Because it's a cell that's not doing anything else but telling those cells around it what to do. I mean, a kidney epithelial cell is doing its job, but a mesenchymal stem cell is telling it to become what it is. And that happens through chemokine gradients, protein gradients. Even from the first cell to the eighth cell, the cells learn to become mesenchyme based on how far away they are from the original cell. It's just, that's it. It's a physical thing. So these cells are telling cells around it what to do. When we're young, they're telling us to grow. When we're adults, they're just telling us not to be inflamed, but they're not telling us to grow anymore. So the younger we go, the more proteins we get getting expressed from mesenchymal stem cells. So when at our age, there's about 110 growth factors or factors being expressed from a protein. From a child, there's 300. A lot of those, like I said, are anti-inflammatory and growth instantiating. So when we hurt something, or when we get to 20, we stop growing and then we just peter out. But when we hurt something when we're 50, we need to fix it, but the fixing signals aren't there anymore. So, I mean, exosomes are such a great thing because we can replace that growth signal for a short period of time and then they're going to go away because we don't want to grow too much or we get cancer.
Right.
And that's what I was really afraid of from the start here, was that I was going to cause cancer. Now, these things are so great that I understand through other people's research that in many cases, like say pancreatic cancer, the majority of mutations in pancreatic cancer are in KRAS and P53, which are two tumor suppressor genes that keep cells from growing. So even if that gene is mutated and the protein's not being expressed, if I replace the messenger RNA for that protein does get expressed, it's going to make the cell do the right thing. And in fact, that's what's being shown.
So basically, these messengers can turn on or off certain genes or expression of certain genes. So
well, if you're not making the right gene, we can just put the right gene expression back in without having to touch your DNA, which is dangerous. Right?
Is it sort of like a targeted epigenetic approach?
It very much is, right?
Yeah. So that's interesting. So, because I'm wondering about the concerns that you had and seeing if there's anything on the horizon that you still have a concern about when you say, okay, maybe what's the reason that we start to see the changes when we get older, that we don't have these growth factors available anymore? We can see the upside of having them available, but could there be a potential downside, or you're not seeing that? I know you were concerned about cancer. You're saying that one you're not seeing.
I'm not worried about that.
Any other concerns?
Well, I haven't figured it all out yet. And what I like about this is I just have to believe in youth, right? So a baby is doing whatever a baby does. And babies don't get cancer, and babies are anti-inflammatory, and babies grow. Babies probably do a bunch of other things I haven't thought about yet. Come back in 5 years. But it seems to work for them, right? And that's what's amazing. And that's why I liked bone marrow transplantations. If I want to kill a cancer and I don't know exactly what to target, let's just throw my whole immune system at it and see if one of them catches it.
Right.
That's what we're doing. Let's just throw a normal cellular milieu at this problem and see if it fixes it.
Yeah, so now with your research and what you've been developing and kind of the track that you're on, is the most exciting thing that you're working on right now the exosomes, or is there some other aspects of it? Because I think some people are getting confused between, what's a stem cell, what's an exosome, are they the same thing? They're kind of used interchangeably. When people say stem cell therapy, it's not necessarily stem cells that they're injecting. So can you clarify some of those things?
There's a lot of misunderstanding. And even the word exosome is like the word fruit. I mean, there are apples and oranges.
Right.
I'm dealing with one type of exosome right now because I'm trying to get as much knowledge about that one as I can.
Which one is that, incident?
That's from a placental mesenchymal stem cell.
Okay.
But if I wanted to make a more anti-inflammatory exosome, I would get it from a regulatory T cell. If I want, maybe I want one that causes inflammation. You know, I mean, you can do all types of things with them. The issue is that when people say stem cells, you know, a vial of cord blood is not stem cells. A vial of cord blood doesn't have a single mesenchymal stem cell in it. It does have some hematopoietic stem cells. What it does have a lot of is anti-inflammatory regulatory T cells. So since so many problems are inflammation-based, you put anti-inflammatory cells in there, it helps it. But it's not a stem cell or growth thing that's happening. It's a anti-inflammatory.
Yes, and that's where I think people are starting to get confused as far as, but I guess those agents might impact your own stem cells if they're injected into you, correct?
Yeah, and you know, it must work. I don't like to say anything doesn't work. If somebody says it works, right? But how can we optimize it is what I've been chasing.
Yeah, so now looking at what you think the state of the art is, because you're really on the research side, but you're looking at clinical applications, and that's kind of like this bridge usually between academia and you know, the clinical aspects of things are sometimes two different worlds, but you necessarily kind of have to be you know, linked between them back and forth. So what do you feel like developing applications might be clinically now based on the research you're doing?
Well, you know, I had to make a living, and
Don't we all?
when I wanted to go work in Baltimore at Johns Hopkins, funding was suppressed, so I couldn't go do that. So I got into this clinical stem cell world, which is not stem cells as we're understanding. And, you know, I went from treating people with stromal vascular fraction and bone marrow, helping physicians do that and optimize their protocols, to the cellular expansion and understanding how some people's cells just don't work, to this. And you know, just the understanding that how much is based on inflammation is really, you know, amazing. And what we can do. So if when you do as much research as I've done on this one exosome, and you know the growth factor panels, you know you've sequenced the messenger RNA, you start to understand everything it's doing. Well, you can imagine, and many companies are working on this, a genetically modified exosomes that can do many X amount of things. I think I can make an exosome that can reverse aging. I'm afraid of it too, and I'm definitely going to try that one in mice before I try it myself.
Right.
But these things are possible, and I'm sure lots of people are working on it.
Is the majority of your time spent in the lab right now, or what do you find yourself doing most?
The majority of my time is spent educating now. Fortunately, we've gotten to the point where I'm able to hire capable people. I mean, there was a point where I had to do everything myself, but that's gone. And I have very intelligent PhDs and techs working in the lab. There's a long way to go, but I think that the team is the best part of what we've got.
So now, basically, you've got the corporate, clinical, research side all kind of coming together in your venture.
Trying to figure out how to do that. And then so many people are interested in exosomes. You know, there's so many indications. So now, who do you put on each indication? I mean, how do we get the data back? I mean, I actually, one of my distributors today explained to me why I'm not getting the data back is because the providers are afraid to put their name on anything.
And that's because of regulatory issues for them.
Right. Yeah, right. So I can't get this FDA approved if you don't give me the data. So I'm now sort of focusing on individual physicians that I can actually get data back from, so that I can have this FDA approved.
Yeah, and that's another world that, you know, that I've got some experience with from my prior business activities, is dealing with the FDA, and now it's sort of like, it's kind of a chicken and egg, right? You know, it's hard to advance it, you know, if the FDA is sort of like clamping down and saying, you know, we don't have enough data to be able to support what you're doing, and vice versa. How do you get the data unless you can do it? So you're kind of in that wrestling match, I'd imagine, you know, at this point. So for the physicians who are actually applying, you know, the technology that you're developing in cell therapy, do they do it? It's a matter of being careful about what claims they're making, or, you know, how do they get to market?
It's a lot about the claims. Yeah. I mean, I have been FDA audited, and it was a nerve-wracking experience. But they have my whole process. They know how I do it. This product is for topical application, like the burn victim that you saw. Like I just said, I don't even know what everybody is doing.
Right. So with that, burns would be obviously one area.
Burns are
People
good.
who are in really bad pain and
Right, and
yeah.
then what is the problem with that? It's inflammation, right? This is what's causing that pain. And we know that as soon as you place it on a wound, the pain goes away, like within 15 minutes.
Wow, wow, that's dramatic. Any other pain applications that your product's being used in?
Well, so many are inflammatory based. The exosomes, the reason that I made Dr. Spiel my medical director is because he was really doing a lot of reading and sending me a lot of literature, which was interesting. But then he sent me one that I had wanted to write a patent on, and that's when I thought, I can't let you loose with this information anymore. You're going to have to join my company. So, and that was actually about neurite outgrowth in vitro. So by placing a certain microRNA in a dish with a neuron, it'll start to grow towards other neurons, just one microRNA. So there are so many things that you can do to manipulate and cause all kinds of different things. I mean, that's not inflammatory, that's nerve growth. And that can come from many different sources. That microRNA can be made by a neuronal stem cell, a microRNA can be made by other stem cells. You just have to get your hands on it and it will cause what you're looking for.
With what you're seeing now, if you were to kind of like gaze into your crystal ball, what kind of hope is emerging for not even just pain, but maybe other neurodegenerative, challenges or things that are plaguing mankind?
Well, here's
right now?
a good one is for MS. Tisch Group in New York is differentiating a patient's cells to oligodendrocyte precursor cells and using those in progressive multiple sclerosis to try to rebuild a myelin sheath. That's wonderful, and it's working, and the FDA is on top of it. I think they're at trial 3 by now, phase 3 by now. I think you can probably do that without the cells. You can do that with the exosomes. So now you can treat the entire population that has a myelin sheath disorder, and there are all kinds of peripheral neuropathies, and it's a big deal. So just think about that and a specific cell that works on that. Now you can expand that to every other kind of indication that you're looking at.
That's pretty exciting. So what is the thing that's getting you out of bed in the morning right now that gives you the most excitement?
I'm just fascinated that it works so well and so many people are interested in it. I've been feeling that organically. I mean, the best part of my life is our dinners,
Yeah.
and all the feedback that I get and ideas that we get. I mean, it's just unlimited. Doug likes to say that exosomes are the penicillin of our generation. It's regeneration is the penicillin of our generation.
And isn't that a whole different paradigm of medicine? Because medicine, especially in pain management, has been about let's kill the pain, let's mask the signal, not change anything, heal anything. As a matter of fact, without experience of pain, you could make things worse. Because somebody would say, "Oh, my knee feels fine now." Well, no, it's really not fine.
Well,
you just
yeah,
don't
that's
feel
true,
it.
right.
But what you're talking about in this mode of intervention and care is the pain relief is really just a byproduct of something else that's happening, a healing that's happening, as compared to saying it's the target of the therapy. Is that accurate?
Well, I think we've always concentrated on stopping something, and now we're thinking about starting something.
Yeah.
And that's why we don't see a lot of the benefits of regenerative medicine until 8 months later.
Yeah.
And I've seen everybody tell me this.
So it requires some patience, or it's a process as
It
compared
requires
to saying,
time for their cells to rebuild tissue. If you think it took us 9 months to make ourselves, why shouldn't it take 9 months for some tissue to regenerate?
Yeah, and that's an interesting thing. So, it's sort of this collaboration with the internal intelligence of the body, isn't it? I mean, in the sense that you can't master these functions, but you can observe that they happen. So when you start to,
Right, somebody said it, clarified it for me yesterday when he said that. He said, "How long do you think we can live?" And Aubrey de Grey's always said the first person to live 1,000 years has already been born. And I hadn't thought about that question in a while. And he said, "How long do you think we can live?" And I said, "Well, I think we can live forever. Right? I think that we are immortal, right? We're descended from the first cell. Technically, every mother makes an oocyte. That cell then grows. We, as a species, are immortal. So why can't we just harness that in ourselves?"
and that is that spark of life. Is when you say that. That's that
The
spark
DNA's
of life,
there.
right?
You just gotta learn how to turn it on.
Yeah. So do you stay? Do you preserve a sense of wonder around all this, and kind of the fact that
Yeah, like the tumor suppressive abilities of exosomes. I mean, from staying awake at night, worrying about it for years, to suddenly understanding that it can stop cancer.
Yeah.
That's a lot. That's a big deal. And this is why I'm in this, is because my father had leukemia.
And I was just about to say, so, if you were to try to characterize what your purpose is in this work, I think you just partially spoke that, saying as far as, a tragedy in your life is something that's given you motivation. And so if you were to describe your purpose in your terms, how would you do it?
Well, I mean, I've studied hard my entire life. When your father dies and you think you're so smart, you don't feel like you're very smart. So let's try not to lose my mom that way,
Yeah.
or my loved one. I mean, I'm not married, but I would imagine if I had children.
Yeah. You'd add new meaning to the work that you're doing.
Exactly.
In the world. What's the next steps for your company and where you want to go?
Well, there's a lot of people saying that they make exosomes now. I mean, there's exosomes in everything. There's exosomes in milk and in urine. Mm-hmm. Now, there are real $350 million funded exosome companies coming with their specific exosomes. And they're going to be FDA approved and their drugs, et cetera. If you go out and sell amniotic fluid and say that it's exosomes, there are exosomes in it, but there's also vernix and baby urine, et cetera, and all types of things. And somebody follows protocols thinking that, oh, well, I read this exosome protocol and I used this product that said it was exosomes, you're going to kill somebody.
Yeah.
And that's going to ruin the exosome potential, which we just discussed, which is enormous.
And that's what keeps you up at night.
That's what keeps me up at night, and that's actually what my job has sadly become, is educating people as to what is and is not an exosome.
So you're bringing up a good point as far as looking at consumers, who would be, somebody out there's watching this and they're excited about the possibilities for themselves or a loved one based on the technology as we're describing it. And then now, if you were somebody who didn't have your academic background, et cetera, but you were in need of maybe this type of therapy, how would you research? I mean, what would you advise people to say?
That's a scary thing, because I've had people and I tell them exosomes, and the first thing they see is cancer exosomes, and they freak out. I don't want to get cancer. Like there's exosomes from everything. And cancer exosomes, like the diagnostics of cancer now has completely been revolutionized, because rather than having to go in and biopsy or something like that, you just take some blood, and in prostate cancer, there's an elevated number of exosomes. And so you look at the exosome, you can see the DNA mutation that you're having a problem with without having to be invasive at all. And then you can try to treat it. So that's fantastic, right? So it's great. It's a great thing that cancer secretes exosomes. You've just got all kinds of different types of exosomes.
We've been talking kind of in the generalized context. Are there specific cases that maybe you can talk about so we can see what happens to actual individuals when this is applied?
So I have kind of a funny story. I used to call these things secretions because nobody understood the word exosomes.
Right.
And that's what's frustrating about people picking up on the word now. I spent years trying to tell them what it was. But I've gotten a girl pregnant with my exosomes. And it was a friend of mine who's had inflammatory bowel disease for 20 years. She tried everything, macrobiotic diets, etc. I felt really bad for her. She's having bowel movements 10 times a night, couldn't sleep. So she used them as an enema. She was able to suppress that IBD. But it also ruined her rhythm method. And she and her partner had been doing it the same way for 10 years, and then she suddenly got pregnant. But that's fantastic. She's 41 years old. And there's a beautiful baby boy now, and we're seeing that type of thing. So think about it. When I was 8 years old, and they told me that women had all the eggs in their bodies that they were ever going to have, it didn't make sense to me at that time at all. And that's not how it works. You have oocyte progenitor cells that are creating oocytes every month, and if you put the growth factors back in there, you'll keep making them. So you can keep a woman fertile for her entire life. It's just those growth factors are falling off just like every other growth factor we've discussed.
And I think you're bringing up another point in the sense that sometimes people have a specific condition like irritable bowel syndrome, as you're describing, and they're targeting a therapy such as you're describing toward that. But it's really not just, it's not a single bullet on a single target, is it? It's going to have systemic effects that could be beneficial, that were maybe, how can I put it, the opposite of adverse effects, but beneficial effects that aren't really part of the motivation for getting therapy.
Well, think about this. Why does your IBD go away when you're pregnant, and why does your skin glow? Right? The name of my product is ExoGlow, right? Because that's what it does to your face when you use it. The pore size shrinks, your skin just looks younger and healthier. Well, the baby is secreting baby exosomes that go through the circulation and into the rest of the mother's body. Cells don't cross the placenta, but the exosomes do.
And that's absolutely true, because there is a glow, with pregnant women, and now you found the mechanisms, that create that glow.
Yeah.
It's
You want
fascinating.
me to creep you out?
Yeah.
When you drink cow milk, it has cow exosomes in it, right? So after you drink that milk for a period of 3 to 4 weeks, you express cow proteins.
How enlightening. Wow. Well, yeah, I guess that gives credence to the old adage, you are what you eat.
Yeah. Yes. See, learn something every time we talk.
Fascinating. So, how long are you going to live?
Forever.
So you're seeing that. You think that...
Well, no, I'm probably going to get hit by a bus.
Nice to know that you're an optimist.
Yeah. I should probably start sooner.
Yeah, so, but basically where you see the curve now as far as the application of technology and how fast its development and adoption, you're seeing at least significant life extension within our lifetimes.
The gold standard exosome is going to be genetically manipulated and a drug, that's for sure.
Yeah, and the byproduct of that is going to be this longevity that ensues.
Right. Well, I mean, we die for two reasons: the turnoff of the cells that we're talking about, of the growth factors, and the inflammation that's caused. And the inflammation is being caused because anti-inflammatory factors are also being turned off.
Mm-hmm. But is it the inflammation itself that's the killer, or is it
atherosclerosis is inflammation and fibrosis of the vasculature? Everything is inflammation.
Yeah, and then if we can introduce young cells that kind of bias the system down to a younger state.
You don't really think about how anti-inflammatory you are.
Yeah.
I mean, we are in a really anti-inflammatory, turned off state all the time. Mm-hmm. And inflammation doesn't happen until you get two signals, not even one. Inflammation doesn't happen until inflammation has to happen. Mm-hmm. So we have so many cells that secrete anti-inflammatory factors. Bone marrow works not because there's mesenchymal stem cells in it, because there's regulatory T cells, because there's myeloid-derived suppressor cells, because even young monocytes, macrophages, secrete anti-inflammatory proteins. And the reason the bone marrow is so anti-inflammatory is because if you inflamed a hematopoietic stem cell and differentiated it, you'd die. Mm-hmm. You need to keep those cells safe and surrounded by anti-inflammatory factors. So that's what I find so amazing, is that everything happens when those anti-inflammatory checkpoints start to fall apart.
So now this kind of begs another issue, problem, or challenge, in the sense of, all right, so the cost for access is going to be going down over time to these types of things, right, the exosomes, because it's wider adoption, et cetera. Money is certainly going to be pouring in investment dollars to get this stuff developed.
Yeah, it is. It is.
And so...
It's still not that easy. I
yeah.
mean, to do this in a safe manner, you have to have a lot of people. And there's a lot of testing that goes on. And, I mean, there's 25 people in my lab as it is, and I'll probably hire more. So there's a limit. When people say there's no barrier to entry, okay, you go try and do it.
Yeah, I think there's some barriers.
Yeah, exactly.
But now, if we start to extend the lives of a lot of people, and we're looking at Earth population, do you ever give any consideration to that? Or what the implications might be?
I have not thought about that.
Yeah, because that's a natural consequence, and again, maybe not necessarily a bad thing, but it's...
I cross that bridge when I get to it.
Yeah, let's get there first, I guess, at a bridge, and then we'll figure that one out later. Yeah, I get that. So, a final thought on, the people are saying, wow, you've captured me, you've captured my imagination, I've got a loved one of myself that, I think can benefit from this, and I want to start taking steps. What's the first thing they should do?
Well, be diagnosed. That's why I love my interaction with my physician partners. I feel like I can fix anything, but I sure can't tell you what's wrong with you.
Right.
So getting the proper diagnosis is really the first step.
And then from there, taking steps towards whether these therapies, but making sure you're
right,
getting...
what needs to be done.
Yeah.
Like I wouldn't suggest a cancer patient take exosomes right away. I would suggest a cancer patient follow the established protocols. If nothing is working, then we'll talk. You know?
Yeah, that makes some sense. Well, I certainly appreciate you sharing all this with us. It's a fascinating concept, and I think you're a fascinating person in the way that you think about this and how you're approaching it in your own mind. So thanks so much for sitting with us.
Thank you very much.
Really interesting to look at how people's career paths unfold, and Duncan Ross was no exception. What a fascinating story and what great information. Really glad you were here with me for this interview. It's patient and procedure time, so if you don't like looking at procedures, you might want to just miss that part of it. But I really think you want to definitely tune into what the patients have to say. And if you're someone that, a needle or a little bit of a procedure doesn't bother you, then you're going to enjoy this entire segment. So let's dive in. Well, here you are.
Here I am. Hi there.
Welcome.
Thank you, thank you.
You've traveled a long way to get here.
I have.
So are you looking forward to this?
Oh, I really am.
What
I
are,
wanna
what are
see
your
yours.
expectations?
That I have a little bit more energy. I have great energy anyway, more energy, and that we work on my shoulder. See if we
Terrific.
can get my shoulder to be back to normal.
Well, I'll let them get to work on you and we'll talk about it later.
Sounds wonderful.
Great.
Thanks.
Enjoy.
Okay, here we go.
Here we go.
Pinch.
Nicely done.
Thank you. So that practice I get when you get to work in ICU and all that
Oh my
stuff,
God, you
you
gotta
get your chance.
Do.
And on sick people, not, so hitting somebody who, I'm sorry if that pinched you. You get your chance to do a little bit. On well people, it's a lot easier.
It certainly is.
Okay.
Those poor old people and sick people don't have any veins to get.
No, they don't. They don't.
It's really hard.
They've aged. Their veins have aged.
I
And
know, no question.
if they're sick, if they're really have chronic diseases, if they have heart issues, cardiovascular,
Right.
they really don't have anything. Okay, so what I'm going to do is this is the blood. We're going to take this, spin it down, and make for the honey matrix to inject into joints.
Collapse on us?
Yeah, it's trying to.
Don't let it do that.
No. It's a small vein.
Slowly.
Slowly, it's coming. It's taking its time.
Yeah, so we're going to make this as painless as possible for you. And the way we're going to do that is we're going to use ultrasound guidance, and that's going to allow us to be very precise to get it right where we want it to go. So we're going to use the ultrasound where we're going to be able to guide it right to the right spot, but not only that, we're going to numb the skin up as far as where we're going to enter, so you won't feel the needle going in the skin, and that actually makes a big difference as far as your comfort level. And then the first syringe is going to be full of a numbing solution. So as we advance the needle towards the site, we're going to be injecting a little bit of numbing solution. And so once we get to that site, we're going to kind of numb things up, and then from then on, you shouldn't find that you're having any discomfort at all. And then we're going to try to break up a little bit of that calcium as well. See the needle there in the top right, Marcella? You feeling any discomfort?
A little.
So kind of put it right over the bursa, and that really numbs things up quite a bit. There you go. And that's kind of right around in the tear. Looking good. You okay?
Mm-hmm.
Yeah, I can feel the
Yeah, I can
calcium a little bit there. You feel that kind of like sand?
feel it.
So if we just did this and we didn't put PRP,
Yeah. Mm-hmm.
it wouldn't be good, right? But we can do this because we're gonna heal it up. There, yeah, you see it kind of going into that complex tear area, flowing pretty easy.
Is that the PRP you're using?
That's the honey and the exosomes. Well, the honey has the growth factors in it.
Got it.
Yeah. There's just some fluid there. Let's go right into that bicep tendon area there. There you go. This might be a little sore here. There you go. Let's go right in that capsule. Give you a little numbing. Okay. Is that spot pretty achy?
Mm-hmm.
That's your bicep tendon. You can see it kind of filling up around that bicep tendon.
Mm-hmm.
You see it kind of moving all around this tear here.
Yeah.
I mean, can you imagine doing this without imaging?
No
Like,
way.
would you
There's no
would you
way.
ever want to get this done without
No.
seeing what's going on? You know, they did a study with.
They do. I mean, a lot of people are doing it.
They
It's
do.
just- It's crazy.
Yeah, it shouldn't be allowed.
No, I agree with you.
All right, so we're going to come back here and we're going to look at some spots in the back. So you tell me, did you feel much discomfort with that?
No.
So there's your glenohumeral joint here.
Yeah.
This is the capsule, attaches right here.
Yeah.
This is the labrum.
Yeah.
So we want to come in and we want to inject into the glenohumeral joint because you've got a little bit of wear on that joint.
Yeah.
Yeah, it's not smooth. And then you can see the,
Both here.
well, if we do this, watch this. Kind of move it back and forth and you can see this starts to
Yeah.
come apart a little
Yeah.
bit. It's not one nice solid triangle.
Right.
So that's another benefit with the ultrasound is you can do dynamic studies. When someone comes in with an MRI of their shoulder,
Yeah.
I'm like, okay, great.
Right.
But now get on the table, let's
Right.
really look at
Right.
what's going on.
Right.
You feeling any pain?
Just a little tingly.
You can see the harmonics there, right?
Mm-hmm.
I'm pretty sure that's in the joint. It's the labrum. Let's switch it out. You see the
Yeah.
movement there. Yeah, that's good. That's a good spot. Okay. Yeah, that's in the joint. So let's try and catch that capsule. Might be a little sore here. There you go, right there. All right.
Okay.
Ready to go dance again. Excellent.
Okay.
All right.
Good. Cool.
All right, so we're going to do some laser on you, and then we're going to put you in a whole body cryo chamber,
Yep.
and then we'd like to also maybe get you in our CVAC.
Whatever you
let's
say.
just get this to heal like you were 20 years old again. Yeah.
That's good to me. Gotta dance.
Like I said, I'm going to be doing 10 minutes, okay?
Okay.
Marcel, I'm looking forward to this conversation.
Yes, oh my.
So let's hear about your background first, as far as your professional background.
Sure. I've been doing women's health. I have a clinic in Yarmouth, Maine. I've been doing women's health for 33 years and have been doing functional medicine for almost that amount of time. I teach for the Institute of Functional Medicine, have been doing alternative functional medicine my whole career.
What is functional medicine?
Great question. So functional medicine is really starting to understand what's the cause of the cause. Really starting to, they call it a systems biology approach. So you're really understanding all the things that create that diagnosis. And really knowing then, when you understand biochemistry very well, where to intervene instead of using a medication. So it's using a systems approach. All the systems get involved, so you're really trying to get people better on every level.
How did you get started on that path? Were you a traditional
Yep.
in a traditional medical realm?
Absolutely. I got trained in a program with Harvard Med. I grew up in Australia in the outback, and I was, from the time I was a little girl, watching the Aboriginal caves, and I always had a sense that it didn't make sense in medicine the way we did things. And learned about Edgar Cayce in Virginia Beach, Virginia, and looked at a lot of alternatives and knew I needed to get certified and credentialed appropriately so that I could start doing alternatives, because I was always interested that that was truly the way people got better.
So how did you stumble upon functional medicine?
I went to a conference very, very early in my career, and I heard Jeff Bland talk, and I was blown away. He understood the biochemistry really well, but also then looked at what do we need to use nutrient-wise. Is it a B vitamin deficiency, zinc, magnesium? And then when I started using that, including understanding the microbiome of the gut, all my patients started getting a little bit better. As I started using dietary changes, I used macrobiotics, I used many different things way back when. And people started getting better when they weren't getting better before. So I was hooked very early.
Wow. So now you show up as a patient.
I do.
So what were you coming here for? What got you here?
So I do ballroom dancing for my own stress reduction. And I
Wait a
was...
minute, ballroom dancing.
I do.
And this is stress reduction.
It is. Are you kidding? Yes.
Okay.
When you're dancing, you can think of nothing else. You have to be very present.
Sort of like
because if
scuba
you
diving?
don't- Yeah, maybe. I don't know. I don't scuba dive. So I was dancing, and I was in the Dominican doing bachata and salsa, and I fell on the beach
Ooh.
and tore my rotator cuff. And went and had an MRI, and it was 2/3 torn, and I was given the option of surgery, and that was not my choice.
Right.
There's no way. So I was waiting to find a place to do stem cells and alternatives and do PT at the same time so that I could really heal.
How long ago did you have this injury?
A year ago.
A year ago. So it's so basically, as much as it's going to heal on its own in that year is
Right,
probably
yeah.
it. So now
And then
you're-
I also tore my biceps at the same time.
Oh wow. And so now your hopes for this is that it will continue to heal, or that you'll have more function out of it?
Absolutely.
Pain levels? A lot of pain?
You know, it's interesting. At first, I didn't have much pain. And then as I continued to use it more, flying a lot, putting a suitcase above, it got worse and worse, so that I wake up with pain. And on a scale of 1 to 7, if I'm dancing, it's usually an 8.
Wow. So it's very
Yeah.
painful.
Yeah, well,
And any other things that you tried on the natural side before you got here?
oh, sure. Turmeric and fish oil and evening primrose oil and, homeopathics. Yeah, all
So you've
those.
done all that stuff. And do you
Yeah.
think all that stuff could help to...
Oh, absolutely.
Yeah.
But it depends on the degree, and also I wasn't probably careful enough at times. And so I continued to dance, and I'm not going to for a month.
I get the feeling you don't like to be restricted too much.
You think? Yeah, I might need to wear some kind of restraint on my arm.
Yeah. And so you've gone through kind of your functional medical protocols,
Yep.
right, around that. And so what'd you have done today?
I had everything done today. I did vitamin C. I did the IV transfusion for the stem cells. I did my shoulder for the stem cells. I also did a CVAC, which is the newest machine they have here, and then the IV vitamin C drip as well. Everything.
Wow, yeah, I say you've had a lot of stuff done.
I did.
And what are your hopes or expectations now?
Well, as much as I know about healing, I think that that's going to facilitate my body's ability to really heal the shoulder. And I think that's going to be the newest thing that comes out. You know, give us 20 years perhaps.
Yeah.
But medicine takes a long time to catch on.
Yeah, it seems that way, doesn't it?
Yeah, usually takes 50 years for things to get really turned around.
Well, so we'll look forward to checking in on you in a couple of months and see how you're doing. And I hope to get a report that it's like nothing ever happened.
That would be awesome. That's what I'm looking forward to.
Thanks so much for sharing your story and allowing us to eavesdrop on what's going on for you as a patient. And we'll look forward to hearing about the outcome.
Yeah, me too.
Ted, thanks very much for coming to share your story.
You're welcome.
So what got you to start exploring stem cell therapy?
I went to a luncheon at Fleming's in North Scottsdale.
Mm-hmm. And what made you want to go to that luncheon? Like, why were you looking?
My buddy talked me into it.
Your buddy talked you into it. So take me through that conversation. What
Well,
happened?
he said, "You want to go have a free lunch and learn about stem cells?" And I said, "Sure."
And
That's how it went.
and so what kind of health challenges were you having that made you want to look at this?
Oh my goodness gracious! I had stage 4 kidney failure.
Wow.
Yeah, and they were going to put me on dialysis, and I'd rather die first, to be very truthful with you. So after the third stem cell shot, I had stage 3 instead of stage 4. So that made me feel just absolutely wonderful. And I was just there Monday of this week, and my lungs are perfect, she says.
Wow.
That made me feel like $10 million, I got to tell you that.
So how long ago did you have did you start stem cell therapy?
Early last year, and the last one was July 31st.
So that would be, maybe 6-8 months ago.
Yes,
in
correct.
that realm. And so you came in not for any particular pain that you were having, but just because you were having some organ failure.
Yes, correct.
And thought this might help me.
You never know.
Yeah.
You never really know.
Yeah, because it's still, I guess, you might say experimental or investigative in these areas, saying, hey, there's not like there's been a lot of trials done on this.
I had nothing to lose.
But when you say I'd rather die than have dialysis,
That's exactly right.
That means you did have nothing to lose.
Yeah, so I was very fortunate with my lungs. They went from, 54 to 75, whatever that is, I don't know. And they're in perfect shape now.
Were they considering transplants or anything for you?
Yeah, I went to Mayo and I qualified for a heart transplant. I had 3 heart attacks, 3 strokes, and 3 ablations. So it's
You've been through that?
Yeah, and it's a miracle. I'm sitting
Wow,
here.
so I had no idea that you had these heart issues also.
Yes.
So you went to Mayo Clinic and then...
I qualified for the heart transplant, but I was too old. See, once you're over 65, they won't give you one. So they sent me to UCLA.
Mm-hmm.
In UCLA, I stayed a week there running all kinds of tests. And my ejection fraction was 19, which qualified me for a new heart. But after you see all the people laying there for hearts and just, you just don't feel right stealing a heart. When I felt, it just didn't feel right. So I just decided not to go for it.
Wow. So how's your heart function now? Has that changed at all?
Well, it's went up some since then. I have no idea why I'm sitting here talking to you, to be very truthful with you. It's just amazing. Mm-hmm. I can do almost anything I want to do. Now I'm going to Europe for a couple of weeks next month.
So you said you're going to Europe now?
Yeah, we're going to go to Switzerland and then Germany and France for 2 weeks.
Now, would this have been possible for you, or would you have considered this prior to having...
Not in a million years.
Really?
Right. Yeah, not in a million years.
Wow.
And just everybody gives me their blessings, so,
Wow.
Yeah, it's just, let me tell you one other thing real quick. I did a testimonial for my heart doctor because it's just a miracle. I'm here, truthfully. It's just, the big thing, they don't understand it, but, all I can tell you is how I feel. I can't tell you any more than that.
Your heart doctor or your nephrologist, your kidney doctor?
My lung doctor.
Your lung doctor. So when you told them did you tell them you were going to have stem cell therapy?
No, I did not.
Oh, so you just went and had it and then came back. What are they saying?
Well, Let me tell you what happened. I go to cardiac rehab down the street on 27th Avenue there, and I had just started that. I was going to Scottsdale because I live in Scottsdale. Anyway, I asked the head guy there, and I says, "Tell me about stem cells." He says, "I'm really not qualified to do that." And I says, "Well, what do you think?" He says, "Well, he had an 85-year-old guy in here a couple of months ago, and the doctor sent him to me. He was going to die." So 1 week of him, and he couldn't handle it anymore. So he went back to his doctor. His doctor said, "Go down to Tucson to see a stem cell doctor." And he had the stem cells, and in 2 months he was back doing everything.
Wow.
So it's kind of like a miracle for him, and that really sold me on it at that point. My goodness gracious.
Wow.
You know, and I'm 77. I'm not, 85, but
Right.
I feel good.
But and did you notice a change in your energy levels?
Yes, an awful lot. As you're that age, you get some aches and pains, but
Sure.
really, I don't have anything. I feel like I'm 50.
Wow.
Yeah, I hate to say it's just unbelievable.
Shouldn't need to say it. You should be happy to say it, right?
Yeah, I am.
I mean, I'm sitting here almost like with
Yeah.
a little bit in stunned silence because you're these are very dramatic things. It's not like, hey, my knee hurt and I repaired my knee.
Yeah.
You're talking about life-threatening systemic illness that that you're on a very bad track.
Yes, I wouldn't be here.
I mean-
truthfully, it's amazing that I'm here.
Wow.
So, and I got 10 kids, 35 grandchildren,
Wow.
15 great-grandchildren, just to give you an example,
15 great
Yes,
grandchildren.
I do, yes.
Wow.
Amazing.
And now you're going to Europe.
Yes, going to Europe, right. So I'm pretty happy about it. My energy level has just, it's been unbelievable. I can't, before I had a very difficult time getting out of bed. I'd have to grab the post and pull
that-
myself out.
Psychologically, were you getting depressed? around all
Well,
this?
I think you have to.
Yeah.
You have to get depressed. I mean, what are you going to do? My wife died 3 years ago, and
I'm sorry.
living by myself with my little dog, and you have to get depressed. There's no, how else can you get?
Yeah.
But now I can do anything I want to do, truthfully.
Wow.
So I'm pretty happy guy right now.
Do you go back to your friend and say, hey, thanks for taking me to lunch?
Yeah, he's a good guy, and he just thought it would work, and he's trying to get enough money together to do it also. So give you an idea.
Yeah, so that's just terrific.
And I sent 2 of my buddies down from Carmel, California, and they both flew down here, and they had all the stem cell treatments here. And one guy had 5 heart attacks.
Wow.
That's unbelievable in itself.
Wow.
And one that he's 69 and Fred's 73, I think. Just to give you an example. So the 73, I took him to lunch, and Fred says, "Fred, what are you doing now?" Well, my wife died a couple of years ago, so I just quit everything. Decided just to. He says, and this was his last shot, by the way, and he says, "Now I started building again." I says, "What do you do?" He says, "I build everything." I says, "You got a lot of work going?" He says, "I got $380 million worth of work going right now."
Wow.
I would never know that. How would you ever think about that? My
Wow.
God.
So he went
That's
from
amazing
he
to
went
me.
from basically giving
Well,
up,
he's depressed.
saying I'm pretty much
yeah,
done.
depressed and
Yeah.
everything, yeah. And
And now
he had a hard time breathing and everything. And,
And he's got $380 million in
and
projects development right now building.
I don't know if anybody else has that. So
Wow.
that's just amazing to me.
So, and because this is always the curious thing, because I come here and we're doing this documentary, and I know that when I'm asking centers to put together some patients we can interview, I know we're just interviewing a fraction of the patients from the center, so I never know how pervasive these kinds of results are. But now when I can talk to you, and you're referring friends, so I'm saying, hey, are your friends seeing results kind of like you did, or what's their experience?
The 9th largest car dealer in the world called me a couple weeks ago. He says, "Ted, can I have this stem cell doctor?" And I told him it was Dr. Travis. And I says, "Well, what's up?" He says, "After seeing you the last 3 months," he said, "I got to go get it done."
Wow.
So he's going to get done at Palm Beach. But
Wow.
it's those kind of things that are just amazing. I'm not young anymore,
Well, you certainly, you're sitting here, you seem you're pretty energetic and...
Yeah, I used to have to sleep for a couple hours every afternoon. Now I don't have to.
Wow.
That's amazing.
It is amazing. It is amazing. Any last thoughts or things you'd like to share?
Well, the big thing with the they said to me, it doesn't cure dead tissue. So the bottom of my heart's dead. It's not going to make it new. It's that simple, but it'll help everything else. And to me, it has helped everything else. So I don't know what else to say.
Well, I think
You
I think you said it all.
Yeah, I think I have to.
It's really impressive, and I appreciate the fact that you took your time to come in here and share this.
I tell everybody.
Yeah.
So it's not a secret. Everybody knows me.
Yeah.
You can't believe it. So I'm kind of a happy-go-lucky guy right now.
Well, Ted, it shows, and your enthusiasm for it is for good reason, well-founded. And thank you very much for taking your time to come and share it.
Anytime you need me, call me. I'll just tell the truth. That's all I can do.
Hi, my name's Alan Dieter. I went to doctors about 30 days ago with my wife. We had exosome treatments. I understand it was more than 10 billion exosomes. We were pretty excited to finally have that opportunity. We felt no adverse effects, neither of us, on the long trip home from Sarasota to Fort Lauderdale. We've been waiting to see what we noticed as a difference. We were both healthy. We did it for general wellness. I'm 70 years old, and I'm looking to do anything I can to increase the quality of life, improve the quality of life, and this was an opportunity that we were anxious to do. We have noticed a few things. We're both sleeping much better. Find that our aches and pains are less. Our general energy is up, and we're pretty excited about what the future holds. I'm told it takes 3 or 4 months to fully appreciate what we did, and I'm planning to do it again. The office was so nice to us, and we really felt this was a great opportunity, and we're looking forward to doing it again. Thanks.
Hi, my name's Duncan Bridewell, and we came down here to Tempe for stem cell treatment on February the 18th. But I came down for various aches and pains and to see if I could get my kidneys to function a little better. I have chronic kidney disease stage 3. I went to the nephrologist in April, and my reading was the same. It didn't get any better. It held at the reading it had been back in November, I think, of last year. But it didn't get worse, which is always a good thing. The thing I have noticed that improved dramatically was my right shoulder. My right shoulder didn't really have much control of my functions. When I brush my teeth or shave, it would really hurt. And sleeping, a lot of pain in sleeping. One thing I've noticed since we did this procedure, the stem cell procedure, is that the shoulder is probably 85–90% now, and I feel like I could actually go out and throw a ball. My knees, probably old age related aches and pains, starting about 2–3 weeks after the procedure, they were much less pain on my walking. We live in Prescott, Arizona, and it's very hilly. That's improved over time, not nearly as dramatically as the shoulder, and I still have issues with my knees, but I look to hopefully to have continued improvement in my knees.
My name is Becky Bridewell. I had the stem cell treatment on February 18th also. I had it for neuropathy of my feet and legs and for COPD. With the COPD, I've had marked improvement. I don't have wheezing and shortness of breath like I did before. I can walk around and climb stairs and do everything. And with my neuropathy of my feet and legs, I have much more stability and balance around the house. I pretty much get around all by myself. It really has done a lot for me.
Well, that's some real life stuff right there. So you get to see how these things look in real life, and I think that's an important part of the process for the information we're looking to bring you. So thanks for tuning into it. This concludes episode 8 of 9 for Pain Revealed. So, wow, what a journey, and thanks for taking this journey. We're deep into it now. We're coming up on our final episode, episode 9. I'm looking forward to sharing that with you. If you've already invested in Pain Revealed, thank you. Thank you for supporting us. If you have not invested in it, during this free viewing period is the time to do it. It is steeply discounted, and we're in episode 8 of 9 right now, so I think now's the time. Great information, a lot of value here. There's different packages affordable to anyone, to any household. Just pick the one that's right for you. Go ahead and get this, bring it home, visit it over and over again as you need to, and share it with others. So, very meaningful to be with you this deep into the series. Let's get ready for our final episode, episode 9 of Pain Revealed. See you there.
When the pain is excruciating and you want an answer, oftentimes you make wrong decisions, rushed decisions, logic goes out the window when the emotions are high. We know it saves lives. Yeah, it really does. There's such an addiction and there's such a correlation to pain meds and even heavier drugs like heroin. It's really neat to open people's eyes to the possibility of feeling good without medication.
One of the biggest things that I've found that's overlooked is the fact that if you're in pain, you need all your energy stores to heal that damaged tissue. It's very hard to heal if you don't have energy to heal.
I'm proud to announce that I'm 67 now,
Wow.
and I have had just an amazing journey, and I'm looking forward to another 67 years on this planet. And you start to realize there's certain things that are your weak spot, the spot that's going to hold you back from living life to the fullest.
To have a day with no pain, it made me feel like me again.
Yeah.
And for one day, that was a perfect day. I had no thoughts of ALS at all.